Hello and welcome back to my channel. Today we are going to be talking about the dreaded mastitis. So this weekend over the kind of Christmas holidays, I've managed to avoid it nursing my two babies for almost 3 years now, which is just mind-blowing. But this year hit me with a wallop, whether it was the stress, the lack of sleep, the fact that I wasn't really minding myself, or the fact that I've been on call for a birthday over the last while, and so have been kind of not emptying the breast as often as I normally would be, or a combination of those factors. I ended up with high temperature, fever, chills, a blocked duct, and so the inflammation behind that is what led to the definition of mastitis for me. Getting to the root of that cause is very much key in terms of how you treat it. So make sure, if you don't know the cause yourself, that you get in touch with a lactation consultant who can help to sort of guide you in this protocol to make it a little bit more specific to you and your needs, and also make sure that it's not something that is recurring for you. But when I put it up on my Instagram, so many of you were like, what did you do? How did you avoid the antibiotics? Because particularly, GPs, in my experience, the first thing that they will jump to is, okay, let's get the antibiotics on board. And certainly if you try this protocol and you end up kind of clearing it within the sort of 24 hours, or if you're able to get to, a point prior to the 24 hours where things are starting to settle, you might be able to avoid those antibiotics altogether. Of course, if your pain and fever persist over 24 hours, I would be recommending getting antibiotics on board ASAP. However, if you notice at the start of those mastitis symptoms occurring and you apply this protocol ASAP, you might be able to avoid them. So let me know in the comment section down below if you have had mastitis and you've tried any of these things, or if you've tried all of these things and they worked for you, or any kind of personal tips or tricks that you might have that have been able to help you avoid the dreaded mastitis. And of course, if mastitis does go untreated, it can end up as an abscess, which is a collection of pus or formation of pus that then needs to go on and be drained under medical care. So let's see what we can do to avoid that. Of course, make sure and talk to your IBCLC if you are having persistent breastfeeding issues, or do send me a little message or an email down below, and I would be delighted to help support you on your journey. But let's dive into what we'll call my 5-ish tips to avoiding antibiotics when it comes to mastitis. So my tip number 1 is going to come as something that is a little bit alternative, maybe, in terms of what we would call the general consensus for mastitis treatment, and that is the opposite of heat application. Previously, prior to kind of some more research that has come out in recent years, we would have said apply heat to the breast before feeding. Nowadays, actually, I say the mastitis is inflammation, right? It's the inflammation generally behind a blocked duct. And so for us to apply heat would be applying more inflammation, sort of aggravating that cascade of inflammatory events that's already taking place. So instead, I would recommend applying a cool compress. So that could just be filling your baby's nappy up with water and then popping it into the freezer for a few minutes. It could be a bag of peas wrapped up in maybe a muslin cloth, but applying a cool compress to the breast will reduce that inflammation right down. My next tip then kind of goes along with that, and that is your choice of pain relief, if you do choose to use some. And many of us feel very unwell when we have mastitis, and blocked ducts can be very, very painful. And in fact, while paracetamol is lovely for bringing down a temperature, choosing either a diphenol or an ibuprofen, one of the anti-inflammatory family, will help you to again further bring down the inflammation that is in the breast. The next thing that I want to talk about is therapeutic breast massage. So it kind of, generally, again, this is a little bit against what we used to advise. We used to think, okay, so say for instance, if you had your blocked duct just here, we would say, get your baby's chin facing that way, sort of massage, really get in there. But actually what we want to be doing is envisaging almost like a jam-packed car park where you have cars in front of you and behind you and all around you. And for you to be able to get out of the car park, you have to clear the cars ahead of you, right? So instead, what you want to be doing is encouraging that sort of the blockage and all of that sort of inflammation that's there to go back into the system. So the way you do therapeutic breast massage, really I should do a whole separate video on this, is actually really gentle strokes, almost like you were stroking a cat, okay? And you're sort of stroking back up towards the lymph nodes, so back up into the armpit, like you're stroking a cat, okay? You can also use maybe 1 or 2 drops of tea tree oil mixed in with a little bit of coconut oil or sort of unscented organic maybe sunflower oil, and doing this before a shower so that you can then make sure you're rinsing away the tea tree oil. But that's said to have sort of anti-infective properties as well, so and antifungal properties, and tea tree oil is fantastic for everything, but not to be ingested by your baby. So before a shower, doing a bit of that therapeutic breast massage. The next thing then that I like to apply, and again this is something that is very, very easy to do, and you can apply it kind of during your day, so before nursing or after nursing, and that is breast gymnastics. So this is a term that has been coined by a fellow IBCLC, Maya Bowman. I will make sure and link her a video where she sort of does an introduction to this concept down below, but essentially it's picking up your breast and doing a bit of movement with it. So remembering that milk is a live substance, it does not like to sit still, so picking up your breast, lifting it up, down, left, right, maybe doing some gentle circles, maybe doing a little bit of a milk shake. So again, the milk doesn't like to sit still, so gently cupping the breast and just shaking side to side like that. Again, kind of alternating and side to side like that again. So that, paired with that lovely therapeutic breast massage, encouraging everything back into the lymph system again, can be the make or break between having to go down the route of getting antibiotics and being able to avoid them altogether. So lovely therapeutic breast massage, or breast gymnastics. The next thing is emptying the breast, okay? So if it's too painful for your baby to nurse at the breast, you want to make sure that you are doing pumping in replacement of where your baby would ordinarily nurse. So making sure that the flange fit is appropriate, making sure that you've got generally a hospital grade breast pump, things like the Haka, which is not a pump but more a milk collection device, or a manual breast pump, are not really going to cut it when you're talking about effective milk removal. So you're talking about continually removing that milk and being able to sort of clear that blockage in particular. Other things that could be helpful when it comes to actually removing the milk would be allowing gravity to work in your favor. So things like dangle nursing, where you're literally leaning over your baby and allowing gravity to work both in your favor and in baby's favor to really remove that blocked milk duct, can also work really nicely. The next thing that I always suggest, along with nursing really frequently, is resting really, really well. So during this time, while you are trying to avoid antibiotics and clear the mastitis, you want to be getting into that bed, okay? So you're talking about your new sort of quote of that week, or quote of that for that period, is prioritizing rest and just saying, I'm going to go back to bed. So you might want to get up and have a bit of a meal and then say, okay, I'm going to go back to bed now. Just in the same way as you would have in your initial postpartum period, when you were kind of encouraging your body to rest and recuperate after birth, you want to be resting your body. Your body is doing a lot of work to help you fight this mastitis, and you want to be able to give your body as much of an opportunity to do that. So just in the same way that we're resting our body, we want to also be nourishing it. So lots of warming, nourishing foods, hydrating yourself really well, doubling up on things like garlic, vitamin C, pre and probiotics. So if you were sort of drinking things like kefir, or if you were having sauerkraut, things like that. But also there are particular strains of lactobacillus, but 2 in particular. I will link the articles that sort of support this down below, that have been found to help with mastitis prevention and treatment. So they're all things that personally I did that all really, really worked for me to be able to avoid that. So rest, therapeutic breast massage, minding and nourishing my body, breast gymnastics, nursing as many times as you can, offering the baby the breast where you wouldn't ordinarily, and that's pretty much it. So I hope that some of these have been helpful for you. These are things that I did. Let me know what has worked for you. And ice was the other one. So avoiding the heat, bring down that inflammation. Some of them might be a little bit contradictory in terms of, or conflicting rather, in terms of what other IBCLCs might be saying. I'll make sure and leave the evidence down below. I try to keep as up to date with whatever the current evidence is. So this is where we are currently at in terms of mastitis treatment. Bring down the inflammation and try and avoid antibiotics if you can. If your fever persists for more than 24 hours, do go and get your antibiotics and try and get to the root cause of it. Touch base with an IBCLC, and best of luck in clearing your mastitis, because it is miserable, and get well soon. I will see you in the next video. Thank you so much for watching.